Welcome to today's webinar entitled Preparing for Reopening, Considerations for Adjusting WIC Clinic Operations Throughout COVID-19. Our guest speakers today will be Barry Kelly, Director for the Bureau of Community Nutrition Services and State WIC Director for South Carolina, Melinda Morris, WIC Manager for Boulder County WIC in Colorado, and Jody Shriver, WIC Project Coordinator for Muskingum County WIC Program in Ohio. This webinar is hosted by the National WIC Association. The National WIC Association provides its members with tools and leadership to expand and sustain effective nutrition services for mothers and young children. Our vision is a nation of healthier women, children, and their families. Thank you for joining us today. I'd now like to introduce the Reverend Douglas Greenaway, President and CEO of National WIC Association, for his opening remarks.
For over 4 decades, our WIC community has successfully assured the availability of WIC services for families in need. We've accomplished this despite funding uncertainties, political uncertainties, government shutdowns, complex regulatory and administrative policies, public relations threats, population displacements, natural disasters, and economic crises. Never, though, have we faced a challenge as dramatic, even life-threatening, as we face in this COVID pandemic. We are all feeling the consequences of this public health crisis. It has turned our personal and professional lives upside down. It would not be extreme to say that we're all in a near constant state of grieving for what was, but is no longer. And there is more than enough evidence to suggest that the necessary adjustments we've all had to make out of an abundance of caution and to save lives will be necessary in one form or another for some time to come. But of this I'm confident. You've got this. In characteristic WIC fashion, you continue to deliver lifelines to WIC families throughout this pandemic crisis. And you've done this with heart and patience, with creativity and imagination, and with the firm knowledge that the services you provide make meaningful differences in the lives of our neighbors. I am always inspired and encouraged by your dedication to the mothers and families you serve every day in WIC. At a time when public health is not especially popular, you have all proven yourselves extraordinary leaders. The National WIC Association Board of Directors and staff have done a remarkable job of supporting you through this crisis. Where others may have been silent, NWA has walked with you every step of the way. Staff have pressed for greater opportunities to help you innovate, for more program flexibility and funding, have delivered opportunities for thoughtful dialogue and collaboration, have shaped COVID-specific messaging, have promoted WIC access, and have created exceptional education experiences. I'm extremely proud of their commitment of service to you and to WIC families. Thank you for your continued membership and your support of the National WIC Association. You can count on this with certainty. We've got your backs. We will do everything in our ability to help you grow a nation of healthier women, children, and their families. Now I'd like to turn the program over to Brian Dittmeyer, Senior Public Policy Counsel.
Thank you, Doug, for sharing those thoughts. And I would like to just reiterate those sentiments with everyone. NWA staff, we are all here to support you through this very uncertain time. And we hope that this webinar can really be helpful to providing some clarity around the situation of what's happening with USDA and the the decisions that are being made here in Washington, and then also provide some insight, some ideas, and some perspective from your colleagues in different states as we all think through what it will look like for WIC to reopen and return to normal operations. Of course, this must all be said that reopening clinics, normalizing operations, and moving back to how things were before the COVID crisis comes at a time when the program is certainly thinking through other opportunities of streamlining WIC services and certainly continuing to innovate and refine our service delivery to WIC participants. And so while we have learned a lot in the last few months, let me be clear that NWA is not only going to support you in this immediate crisis, but also to take lessons learned from these past few months and certainly work in a collaborative manner with this community to advocate for long-term positive change for the WIC program as well. To begin, I'd like to just provide a little bit of context to the waiver framework that has really enabled everyone to adapt services in this time period. For the waivers, after significant advocacy in the first few weeks of the COVID crisis, waivers were included in the Families First Act that passed through Congress and was signed on March 18th. Immediately after passage, NWA, having gained significant insight from state directors, local agency directors, and other partners in the NWA membership, sent a letter to USDA outlining specific waivers that were needed to adapt WIC services, including the ability to conduct remote certifications and remote benefit issuance, food substitutions, and solutions for the smart card or offline EBT states. USDA, under the terms of the Families First Act, has the authority to extend waivers through September 30th. However, they did not elect to do so. Waivers were initially granted through the end of May, and just over this past weekend, we have received notice that state agencies have received extensions of all approved waivers through June 30th. So as of now, that is the date we're working with. We know USDA has the option to extend them further, and NWA has been consistent in the point of the waivers should be extended through September 30th to afford maximum flexibility to state agencies. In addition to ensuring that the waivers are approved by USDA, we know another layer of state planning is what is coming out of your governor's office. A lot of the decisions around what is open and what will be reopened is being made by the governor and certainly with a broader perspective of not just WIC clinics, not just public health offices, but also businesses, parks, playgrounds, public spaces, and so on. We know that nearly every governor has articulated some form of reopening plan for businesses and society generally. While WIC clinics are generally not singled out in those plans, we have been advocating with states to hold off on WIC clinics being in the first wave of those plans for reopening, and so that WIC clinics are given especially the population that we work with and the logistical challenges of bringing children into a social distancing environment. We want to be very cautious with reopening WIC clinics and, again, preserve the option for keeping remote services or modified services for as long as possible throughout this crisis. I know that everyone is keeping an eye on when the waivers are due in June 30th, but we are also keeping a long-term view for the waivers as well. The current authority is through September 30th, but Congress has been alerted that the waiver authority may need to be extended even further, especially if there is a resurgence of the coronavirus in cooler months in the fall. And so with this being said, NWA continues to advocate to Congress and USDA that waivers are extended for the longest period of time necessary to create flexibility for state agencies to make the decisions best for their own agencies and their own communities. We are also, as I mentioned, keeping a running list and open to all of your perspectives on what is working throughout this time period. And after the COVID crisis has reached a conclusion, we will be lifting up the ideas that are working as permanent positive policy suggestions to ensure that we continue to meet the needs of WIC participants and deliver services effectively and in an innovative manner. With that being said, I'd now like to introduce Barry Kelly to report on his perspective of reopening and the steps that the program in South Carolina has taken. Barry, take it away.
Thank you, Brian. Sending prayers to you and your family during these challenging times. I want to thank you for the amazing work that you are doing to provide WIC services to moms and babies across the nation. I would also like to provide a big shout out to Team NWA for pulling this webinar together because we definitely need it. I want to thank the Southeast Regional Office and all WIC staff here in the great state of South Carolina for the amazing work that they're doing to provide WIC services to mom and babies during these challenging times. Next slide, please. I want to share with you some of the things that we're doing here in our great state. As Brian mentioned earlier, the governor signs an executive order which kind of directs state agencies on exactly what actions that we are going to take. South Carolina Governor McMaster began initiating a reentry plan no later than June the 1st. And this is a picture of one of our WIC family members in a WIC clinic. And as you can see, normally that would be a very busy area, but we are providing service remotely, so most of our clinics are pretty empty right now. Next slide. Next slide, please. Can you go back one? There you go. Thank you. I will tell you the number one priority for me as a state WIC director is the safety of our WIC staff and the safety of our participants. So every decision that I make and leaders make here in South Carolina is safety first. Our Department of Human Resources has been looking at the guidance from CDC and OSHA, and with the leaders here have really worked with business partners across the state to develop a reentry plan for all state employees. Next slide. Some of these steps are, one, to make sure that our staff have the protective equipment that they need in order to make sure that they and our WIC participants are safe. We have hand sanitizers throughout our buildings, and we ensure that all our employees understand the guidance that has been provided by CDC and OSHA guidelines. Next slide. We have also, social distancing is a common language today. So we have placed markers on our floor, sidewalk, doors, and elevators to ensure that we're maintaining social distancing. If our buildings have cafeterias in them, some of the seats are being removed, and we're doing all we can to ensure that our staff maintain the social distancing. If a state employee is traveling to a destination within the state, we're limiting the amount of employees to 2 employees per state vehicle to try to reduce the close contact of our employees. Leaders at all levels are given the flexibility to make common sense decisions with reentry back into the workforce. Next slide. Here in South Carolina, we have 3 phases for our reentry. Right now, we're in phase 1. And in phase 1, only the people that have critical core functions will be returning back to work. Telework is highly emphasized here in our state, and a great portion of our state employees are working remotely right now. Phase 2 and Phase 3 has not been initiated as of yet. Next slide, please. These are the 4 critical functions that are listed in the South Carolina Department of Health and Environmental Control Continuity of Operation Plan. WIC services fall under critical 3 here in our great state, and that means that our services may pause if forced to do so, but we're supposed to resume duties 30 days after the event. In this issue, a human pandemic. Next slide, please. These are the core functions that we have listed in our COOP plan. WIC certification, as I mentioned, is a 3. WIC operations, 3. WIC benefit issuance, 3. Nutrition education, 3. Breastfeeding education and support. We have one critical function that is a critical level 1, and that is because Phyllis Allen, one of my division director, actually addresses practice issues related to registered dietitians. Next slide. This is a picture of one of the signs that are displayed on our buildings here across the state. As you can see, it has some helpful information in reference to COVID-19, and we have those posted on the buildings across the state with offices specifically. Next slide. I want to thank Mr. Taylor from the Southeast Regional Office and his amazing staff. Sandy Benton Davis have been absolutely amazing and provided outstanding customer support. These are the waivers that South Carolina has submitted with the date, and those waivers were approved in a timely manner. We have been maximizing technology to improve service delivery for the past couple of years. We transitioned to eWIC in November of 2019. We have over 50 classes web-based in English and Spanish. We have a services on wheels that can go in the community and provide on-site certification. And we have an amazing mobile app that our participants absolutely love. And Beverly did some amazing work with our team here at Central Office. And we now provide nutrition counseling over the phone, which have allowed us to transition to providing WIC services remotely starting in April, this past April. As Brian mentioned earlier, it was great news to hear that the waivers have been extended through June the 30th. I, along with, I think a lot of my peers, highly recommend that we extend those waivers through September the 30th. Schools are still out, and a lot of our WIC staff have young children at home, and so just extending those waivers is critical, I think, at this point. Next slide. Next slide, please. As I mentioned earlier, this is what, reality looks like right now. You can see we have a WIC staff behind the desk, and we have a sneeze guard there, and we have a participant there that's, receiving WIC services. But really, if you go to our clinics right now, they are very empty. We're, really providing service remotely. Participants that are coming to the clinics are driving up in their cars, and we're doing what we can to ensure that we maintain social distancing to protect their health and the WIC staff health. Next slide. These are some more cool pictures. Sometimes the pictures are worth 1,000 words. These are WIC staff and participants. In the Low Country, Kristen is the program manager there, provided this picture to me. And I just want to share that I am so blessed to have an amazing team. The program managers in our great state, Betty here in the Midlands, Jessica in the Upstate, Kristen in the Low Country, and Sadna in the PD, and WIC staff, frontline staff, everyone have exceeded my expectations. Here in our great state during these challenging times, I was very happy when I received the last participation report and learned that we have increased participation several thousands during COVID-19 operations. So the WIC staff is doing some amazing work here, and I just want to thank them all. Next slide. As I mentioned earlier, we've really focused on maximizing technology to improve service delivery. That's what our eWIC card looks like right now. We have a cool app, and I'll tell you, I cannot imagine providing WIC services if our great team had not done the work that we did to maximize technology to really meet the participants where they are, and that's on their smart device these days. Next slide. All right, that concludes my brief presentation. I'm going to turn it back over to Emily. Thank you so much for the work you're doing. I hope you and your family stay safe.
Thank you so much, Barry. I am now going to hand it over to Melinda Morris, who is the WIC Program Manager for Boulder County Public Health in Colorado, and she will speak about reopening a local agency WIC program.
Good afternoon, folks, and also good morning to those of you who are west of me in Colorado. Before I start, I want to just call out the incredible support that my local agency in Boulder, Colorado has gotten from the Colorado WIC staff and State Director Heidi Hoffman, as well as all the expertise that all of us appreciate for the National WIC Association. So today I'll be talking about my local agency experience and where we are right now. And I reviewed the questions and concerns from the attendees prior to starting the webinar, and they are the same questions and concerns that we have. It was just yesterday that we in our local agency found out about USDA extending the waivers through only the end of June. Next slide, please. Can you advance to the next slide, please? Thank you. My staff is a total of 9 of us. We have 6 educator paraprofessionals and 2 RD supervisors. And we serve a caseload of approximately 3,000 participants in Boulder County, Colorado. Boulder County is basically northwest of Denver area and has 3 main cities where we have clinics. Longmont is our largest, Lafayette and Boulder are other 2 smaller clinics, which are only open a couple days per week each. We were, interestingly enough, because some waivers address monitoring of local agencies, our local agency finished our twice every 2-year local agency monitoring on March 11th. We got our report, and it was on Thursday, March 12th, and Friday, March 13th, when the decision was made to work remotely. All staffs took home the equipment that they needed for that, so that on Monday morning, March 16th, we were prepared and began serving our participants remotely. This is our 10th week serving participants remotely, and it is working very well. I won't take the time to address all the things that are working well because I think it's reflected in the questions and concerns in terms of what can we keep, what can we possibly keep that is helping participants as well as staff to deal with the complicated issues that have arisen during this pandemic and the need to stay safer at home. All right, next slide, please. Next slide, please. Thanks. Our reopening plan is unfolding now. As we all know, we found out about the date of the waiver extension yesterday, and that is very significant for my local agency. Our WIC program is located in Boulder County Public Health, and we have begun the process of planning for the reopening, and we're calling that the recovery effort. The public health has been tasked with assisting every single division and program in the county government, assisting them with all their PPE, all their plans of how to get into back into the building, also with assessing what tier the different programs fall in. So public health is assisting us, the programs that reside within public health, but as well as is assisting things like the financial folks, the Housing and Human Services, Sheriff's Department, road maintenance, everything. All of those programs are being assisted by public health. So as I'm sure all of you are aware, public health agencies are really overwhelmed by this effort. So we have a tier structure at Boulder County Public Health and Boulder County in general that is going to be used to determine who goes back when. And so it was just yesterday that we had the answer to whether WIC will be a Tier 1 or a Tier 2 program. So basically, Tier 1 services in Boulder County government are those that have continued throughout the pandemic. Sheriff, roads, maintenance, plows, parks and open space, et cetera, did not close as they were required to continue to work. Tier 2 services are, much like Barry mentioned, services that need to be provided in person. In our agency, we were waiting to find out whether WIC is included as a Tier 2 service. So immunizations and needle exchange are two tier services that my agency will be working and focusing on getting into the building as of June 1. We now are considered the second wave of Tier 2 services to have to go back in because we can be delayed in going back until July. So this is still unfolding really as we speak. And I had to adjust my slides, obviously, based on the news from yesterday. Tier 3 services, which is where WIC will remain during June, are services that may be better in person but can be provided remotely. Next slide. Thank you. So the main buckets that our concerns lie within are clinic location, managing the risk, and scheduling. So the news that I've gotten just in the last couple days is that our agency, because we're focusing on health equity, is going to open all the clinic locations that we have. This was a concern because many participants are unable to, if we don't have very good public transportation in some of the towns, and we're in a somewhat more rural location. So staffs were concerned that we might not be able to open our services in the places that our participants can get to. So we did find out yesterday that we will be able to do that. Our agency is going to be working with a mandate to keep no more than 50% of any staff in any space on a given day or hour. And another question that we have is, are participants going to be able to enter the building? Are they going to be waiting outdoors? There are a lot of unanswered questions that we have. The second concern area for us is managing risk. Because of our county is taking the lead on determining who goes back when, they're also going to be in charge of assessing the needs for PPE and purchasing that and putting that in place prior to the programs returning. Our staff have been really concerned about what are we going to do to protect ourselves and what are we going to do to protect participants. And we only recently learned that we are not going to have to be the ones determining the amount of equipment, the type of equipment that we need, and purchasing that. So that is a big relief to me as a local agency manager. Like Barry mentioned, our agency will be using OSHA guidelines to determine what kind of PPE we need. And so we are currently at the place for waiting to find out what our state WIC office is able to determine about what precisely can we continue to do remotely and what precisely do we have to do in person. So for instance, the PPE that we get will be determined by whether we have to do hemoglobins, weights and heights, whether we have to collect signatures on our electronic signature pad, or whether we collect like a general signature document in person, or whether we can continue to get a non-signature with the reason of COVID-19 as a reason for being unable to get an actual signature. So we may be able to get face shields if we're going to have to do hemoglobins. We'll be fitted for N95 masks for anything we do in the clinic, and we may be needing to purchase plexiglass barriers if, in fact, we have to complete, for instance, an entire visit in person in the clinic. So my agency is waiting and is actually quite relieved that we won't be going back as of June 1, that it'll be July. Again, all of us, including my agency, would prefer for us to have the waivers extended through the end of September, because the burden that this places on the agency at large in adding another program that has to go back into the clinic is really quite large. As far as participants, we hear daily from our participants that they are frightened to come back into the clinic. We've had participants tell us that they will not stay on WIC if they have to come back into the clinic. So that's very concerning for serving the needs of our participants and for keeping our caseload up and providing safety. The most concerned of all, of course, are moms of new babies. And I'm sure all of you are hearing that as well. What we're currently working on right now is problem solving, or beginning to problem solve, how to schedule participants. And we're floating a few scenarios because, of course, we don't know what will we have to do in person and what can we do remotely. So we don't know what that looks like yet. So we're trying some scenarios. And we have been paying attention to what other agencies around the country have been doing in terms of having participants call when they arrive, doing the bare minimum of what needs to be done in person, and then, for example, completing a visit when the participant returns to their car. Excuse me. So what I've attempted to do today is just summarize where we are in this process of still working out all the details and just giving voice to what I'm sure many of you are experiencing, which is just a day-to-day change in what we do know and what we don't know, what we're sure about and what we are waiting on. So next slide, please. If you have any questions directly to me, you can email me. My information is here. And if you'd like to take a look at what our program looks like in Boulder County, you can click on the link below to take you to our Boulder County Public Health WIC website. Thank you very much. I thank you for all the work that you're doing and for attending the webinar as we all work together to figure out how to go back into the clinic in the end of June, early July. Back to Emily.
Yes, thank you very much, Melinda, for your time and energy. Now shifting over to Jody Shriver, who's our WIC project coordinator in Muskingum County, Ohio. So thanks so much, Jody, and I will hand this off to you.
Sure. Thank you for having me. I'm excited to be here and share some ideas and plans about moving forward, I guess. We'll go ahead and skip to the next slide. I'll start off with this image of the state of Ohio. So Ohio is currently, you can see where I am. I'm in Muskingum County as part of the Southeast region. We have our 5 regions throughout the state that include a variety of sizes of clinics, as well as different grantee agencies like a health department or federally qualified health center or a community action program. Currently in Ohio, our system is an offline EBT system, and so we cannot load cards remotely. So there's still the individual with the family still needs to come to the office to provide or to get their card loaded and receive their benefits. So that adds another obstacle or barrier to work around when we think about planning and moving forward. And something else with the varying grantee agencies is you have to think about what rules there are within your agency as well as in the program and across the state before you can start really thinking about a plan that works for everybody. Next slide. All right, so in Ohio, the current recommendations are try to telecommute or work remotely whenever possible, which we're trying to do within our office, keep us to about half staff or minimum staffing, with the whole idea if somebody gets exposed that we can still provide services with the other half of our employees. Employees must wear masks or facial coverings within the office. And currently, my agency is requiring that all of our visitors wear masks or facial coverings too. So within Muskingum County, we do have a stash in the office of masks, and the participants have been wonderful and very, very compliant, and no strong complaints or anything about wearing it. Everyone seems to understand. We are also doing a screening of all employees and visitors on site. We do encourage employees to do screenings before they arrive. And then visitors, we have a temp check person and then also asking the questions about symptoms and signs to see how they're feeling before they really enter the building. We have access to hand sanitizing stations or restrooms to wash your hands, and then there's guidance throughout the office to provide that social distancing and know what the 6 feet separation actually looks like. I think that's all I have on this slide. Trying to merge there, and then we can move on to our program recommendations. So we do have a tele-WIC. We have tried text-WIC. So one day all of our phones were down and we were still trying to provide services. So we started texting, but it would take almost a half day to do a full appointment because you'd have a text and then you have to wait for a response and then you'd answer the question and maybe you get a phone call in the middle. So it was a much longer process than trying to do everything over the phone, but we gave it a shot anyway. I'm super excited for the waivers to be extended for another 30 days. I did not, or at least through the month of June, I was not excited about starting to roll out plans for normalcy, I guess, in a couple of weeks. So I'm glad to see that. The other thing I'm trying to really balance within my program is the safety and sanity of our employees and our participants, because I think that's important to provide good, tailored nutrition education and services to everyone. And I'd like to emphasize that WIC is a nutrition education program, and so our families still need that. We need to emphasize self-care and caring for our families through good food and making sure we're meeting those questions, because obviously, you know, the kids are still growing, their needs are going to change, their development is going to change, and so we want to make sure we're tending to those needs as well. Go ahead and move to the next slide. Trying to merge our program recommendations with our state recommendations and finding that balance between the safety and sanity of our participants and our employees, and working from that. And I'm sure you've seen a pattern so far that I really want to emphasize the safety and sanity. What good is my program if I have no families to serve or employees to serve them? And as I work through developing a plan, I really try to ask that question, am I keeping my staff and families safe and healthy? So when trying to develop a plan, and in full disclosure, I don't actually have an official plan in place for reopening or returning to normalcy, and I threw out my old plans because the waivers came in yesterday, so I thought that was super exciting and kind of gives me hope that I can get a better plan in place that I can feel more comfortable with implementing. So when I think about creating a plan and moving forward, I really like and support the idea of telecommuting when possible, having a partial staff or a minimum staff on site, and seeing who that is and what we can do with that. And then really looking for having like a soft rollout and what that looks like. So I try to set goals for my program. So, for example, if I want to maybe return to a normal or a new normal in like 6 months, maybe I have plans for an operation for 2 months, and then adjusting that for another 2 months that gets closer to normal, and then adjusting it again for another 2 months before we return to that normal. And then if we see an increases in cases, coronavirus cases in my state, then I can go back to any of those 3 stages that we've already practiced and start from that perspective again. So like an ideal stage 1 might be to continue to offer telework appointments through the summer with partial staffing, and really keep my fingers crossed for a waiver past June. Can we do like a modified teleWIC and complete applications and health histories over the phone, determine what information maybe can be emailed or faxed in terms of documentation, and then evaluate each participant individually to determine if they need a weight or a height or a hemoglobin. And then, as mentioned before, how do we get the equipment, the PPE equipment to do those services? And again, since we need to have one member of the household come to the office to get their card loaded, we can get the paperwork signed at that point, try to minimize any exposure. I like one thing I miss about what we had been, or pre-coronavirus, I guess, was seeing those families and having our eyes on the families to see the development and the improvements of the kids, and be able to say, boy, he seems to, speech is really well, or maybe it's delayed, or he walks really well, or so just looking at those elements we can't see, and I think that's kind of frustrating, and I kind of miss that. But that could be part of that modified teleWIC and stage 1 for however long we can do that. And then looking at the modified schedule or stage 2, what do you normally schedule, and how can you reduce that to match your minimum staffing and also minimize the number of people who come into the office for a visit. And looking at who needs to be seen, like, so do we see those moms and new babies? Do we see new to program families? Do we see the families that we have previously documented concerns about their safety or development? In the state of Ohio, the recommendation is to have times for your vulnerable populations, but in most cases, some of our medically fragile individuals are being monitored by a specialist or their primary care provider, so they might not be the person who needs to come to the office. We can see somebody else and keep them from coming in and being exposed to others. So that's kind of like a stage 2 or like a modified schedule, and then we can go from that to do a stage 3 of increasing it even more and maybe bringing more staff back on. Again, I don't know if I mentioned this earlier, so when we talk about our needs of our program and the needs of our families, and then even we have to pull in the needs of our employees to make sure they're able to perform their roles to the best of their ability, and try how can we mesh all 3 of those things together to continue to provide good service and keep everybody safe. Go to the next slide. And I think this is another theme I have since this whole thing started, is trying to find that balance of what we can hold on to, what do we want to let go of, and knowing which to do of either of those. And I think the Frozen song, Let It Go, has been my new theme song, to know when I can step back and be like, that's not something we can worry about right now, or we can let go of that because it does not play a major role in improving the safety and sanity of my staff or my families. So again, there's my email and my local phone number here. I know we only have a few minutes left to answer questions. But if you have more concerns or thoughts to share, I'd be glad to discuss.
So we have a few questions for our panelists today that we'd like to go through, and I think some of these were probably already partially addressed in the remarks from our panelists, but hopefully we can have some conversation right now. And it's becoming very clear that the amount of discussion we need to have around this is probably more than we can cram into 1 hour. So I think we will definitely be scheduling other opportunities for us all to check in about this. And so if your question is not addressed on today's call, we will certainly be continuing this conversation in the coming weeks and months. Okay, so the first question we have for our panelists is, how can we encourage participants who might be frightened to come back into the clinic? And what are some strategies to help maintain a positive experience for participants during this transition? So any of our panelists that want to unmute and weigh in on that, that would be great.
Hi, this is Barry. That's a great question. Not only are participants frightened, but staff are frightened. And so one thing that I think we could do is, we've done a lot of great work on our agency website. It has a wealth of information, frequently asked questions. Adriana Bradley, our senior consultant in charge of outreach, has done an amazing job kind of messaging things, using a lot of NWA amazing products to kind of keep participants informed. So I think messaging is key. We don't have a Facebook page for our program. The agency has different platforms there, but messaging, I think, will help considerably.
Hi, this is Melinda. Yeah, I want to answer that with that. I think the thing that will eventually make our participants more comfortable coming back will be the relationships that we've established with them. We've had really good success in doing both nutrition education on the phone, but also the kind of connection that participants expect from WIC and get, being heard for the concerns they have, being kind of held in terms of having a place that seems familiar to them, which is their WIC educator, to be able to really listen to them during this difficult time and to tell them what we can do for them remotely. So in addition to what Barry said, which is that the messaging coming from our agency and our county will be very well coordinated and widespread. I think that'll be helpful, but I think it's going to come down to the connections that we make, and we'll be kind of like white glove service for the first people coming back into the clinic, and we'll talk with them and work with them around all of our apprehensions and how to negotiate that.
Thanks, Melinda. Jody, did you have thoughts on this one?
Not any more than what everyone else just said. I think the relationships are the big thing, and then explaining what each clinic is doing to keep everybody safe might lessen some fears.
Okay, great. I'm going to skip ahead a couple of questions. I'm going to skip down to question number 4. Since fewer clients will be able to come in during a given day because of social distancing protocols, how will we accommodate all of the participants that we have, and or how should we triage and or stagger appointments? Do we have any recommendations from the panelists on that question?
This is Melinda, and that is the million-dollar question. I am still sitting with that myself, and my team is thinking through that. And we're fortunate that Colorado WIC, our state office, convenes a weekly meeting with all the local agency directors. And so we're really kind of brainstorming together, and we'll be coming up with solutions and at least things to try and test out as we go. It's not going to be perfect when we go back. We're going to try our best, implement our best guesses and estimates, and then we will fine-tune based on how things go.
Thanks, Melinda.
This is Jody, and I was going to add, we were experiencing the same thing. And actually, one of my son's teachers said that she was getting assignments from her fourth grade students at like 1 and 2 in the morning, because that was when she had that quiet time. So it just was a big red light bulb to me that everyone's schedules have shifted and changed. And so looking at what can my schedule be? Like, it might even need to shift to be a 10 to 6 to accommodate the changing needs of our family. There's no reason to come in at 7:30 or 8 o'clock if there's nobody up and going to want to take advantage of that time.
Yes, we have a central appointment here in our state. We try to give participant choices. They could come in person, they could do telenutrition, or they could over the phone, or they could do web-based training. But we've really been focusing on having different options for participants. They're pretty busy, and you know, COVID-19 is another level there. So central appointing to address appointing issues and participant choices.
Great, thank you. Thank you to all our panelists for answering those questions.
Hi, everyone. I'm going to take over. Thanks so much, Emily and Elizabeth. So what if curbside isn't an option? People don't have cars, too cold to wait outside. And I have one of the panelists answer that.
This is Jody, and we've allowed families to come in, just try to have one individual come in. But we also recognize, I see there's a question someplace else about when people can't, when they have to bring in everybody. And I guess I can't not let them bring their children in. We try to do our best and keep everybody as safe as we can. But I feel like that's a sacrifice my clinic has to make for the family that they're serving. And maybe we can make sure nobody else is in the building too for that individual.
This is Melinda, and we are basically, to answer that question, I need to wait on guidance from my agency, because my understanding is that there are going to be very strict protocols that will pertain to every service and program that will be in county, operating from county buildings. So that's something that I don't have the answer to yet, but we will fortunately be able to weigh in on it, but the decisions have not been made yet.
Thank you. We're going to skip down to question number 9, because that is such a pertinent question right there. What would a partial reopening look like?
This is Melinda. What I'm envisioning a partial reopening looking like is determining, is continuing to do remote for everything that we possibly can do. And in Colorado, that means that anyone who we have previously scheduled as needs to come in to have a wait follow-up, but it's not their recertification or mid-certification visit, we don't have to gather those anthropometric measurements until their recert or cert comes up. So those can be transitioned to phone follow-up visits like we've been doing this whole time. And like Barry said, we do that as for all the participants that we're able to do that for. It's part of normal business. So partial reopening means bringing in only those participants that we have to see for physical presence, and that I don't know all what that's going to look like. But the partial reopening is that we're just going to do the things we have to do in person, and everything else will remain remote.
Yeah, for us, possibly reduce staffing, allow staff to telecommute when possible, continue remote services, and follow the guidance provided by CDC and the state and agency leadership.
Nothing more to really add.
Okay. What's suggestions do you have for safe breastfeeding help?
Unfortunately, I don't have a whole lot. My breastfeeding peer helper and I were just talking today about what it would look like if we had a weight check station or something in the office. Could we put it in a isolated area with a separate door? Because we do have moms that have concerns about breastfeeding, weight gain, latch, soreness, pain, and there's only so much you can do virtually. So it has come up, and I do not have a good answer, and I'm really open to suggestions if anyone has any.
This is Melinda, and during this time, of course, we have not done in-person breastfeeding assistance. We have used resources in Colorado put together by Colorado WIC, and we also use our breastfeeding peer counselor program, which is a remote program for us. It is housed in another county, so that always operates as a remote phone consultation type thing. We refer participants to the hospital they gave birth in. Most of those hospitals their lactation staff have adapted to be doing, I think, maybe face-to-face through, FaceTime or what other media means to do counseling for moms who have delivered there. And then we also had a very fortunate situation in our agency, which is one of the IBCLCs working for a completely different program was able to be shifted to provide free counseling to our WIC participants. So we've been able to support them in that way. But in terms of assessment in the clinic and watching latch and stuff, I agree that is kind of in the future. I don't know how we're going to do that.
Yeah, we've been focusing on establishing memorandums of agreement with hospitals and having our peer counselors visit those hospitals when possible. I think one of my peers mentioned FaceTime, and we have a considerable amount of IBCLCs and CLCs in the state, and our peer counselors, have phones and computers and, continue to provide that help remotely. That's what we're currently doing. I wish I had Beverly. She could give you a lot more details on that.
Thank you, panelists. And with that being said, I want to thank all of our panelists for joining us. Their contact information was on their slide, so if you have any questions, please feel free to reach out to them. Please note that the session will be recorded and will be shared tomorrow along with the slides. We do have a couple last-minute things to share with you all. Here are some post-webinar opportunities. Please join the NWA Slack platform for COVID-19 response working group. There's a channel dedicated to reopening. All attendees will receive an invitation for the Slack platform within 1 business day of the webinar. Send your developed guidance, policies, and other resources to share with NWA for our COVID resources page. Also, NWA will be developing an FAQ document, and we'll share this as well. And just another thing, the 2020 Virtual Annual Conference will occur on June 23rd through the 25th. If you're interested in attending, please click on the link included on the slide for more information. If you have any questions about this webinar, please contact Emily Gilcher at egilcher@nwICA.org. Again, I'd like to give a special thank you to our panelists. Thank you, Barry. Thank you, Jody. Thank you, Melinda. Thank you, I want to make sure I didn't forget anybody, Melinda, Jody, and Barry. I definitely appreciate you guys jumping on this call and sharing what you guys are doing at your clinics on the local level as well as on the state level. Thank you again. Everyone have a great day.